So earlier today, the New York Times released their editorial interview with Joe Biden. This is part of a series they're doing where they're interviewing some of the Democratic presidential candidates, trying to find out their positions, their worldview, their philosophies, with a view towards understanding how they would act should they become president. These interviews are long, they're extensive, there's a ton of questions, so you really do need to read through it yourself to get the full perspective. But today I want to focus in on one particular question and Joe Biden's answer to that question, and it revolves around the concept of Medicare and choice. Because this particular idea, this debate, has been one of the formative ones in the Democratic primary so far. On the one side, you have Bernie Sanders, who's making a definitive argument for Medicare for all. Elizabeth Warren is to some degree as well, although she has a staged process. But in general, both of them, at least in broad terms, suggest that the eventual goal should be a system where everyone is under Medicare. Every single person, whether or not you're rich or poor, whether or not you come from any particular part of the country, everyone should get Medicare. And that from efficiency and equality purposes, this is the best way to run a healthcare system. A single payer Medicare for all system. On the other side, you have multiple people, but specifically folks like Joe Biden and Pete Buttigieg, who push the Medicare for all who want it model, or some element of that, which is that they should offer a public option, but allow people to choose. That if you have healthcare, if you have other options, you get to make a quote-unquote choice. And they often frame that in a positive manner, aka it's your choice. As an individual person, you can choose what you want for yourself and your family. And they juxtapose that to the quote-unquote forced nature of what Bernie Sanders and to some degree Elizabeth Warren would offer, which is that everyone has to go on Medicare for all. Everyone has to go on the mandated Medicare plan. But the thing about this question is that it exposes the illusion of choice when we're talking about fundamental needs like healthcare. So I want to read this out to you. But if your employer cancels that plan, then you don't get it. You don't have that choice. No, you don't. You don't have the choice, but you had the choice to. That's why I'm not saying I said, if you like your plan, you can keep it, assuming I should add the obvious, if your employer doesn't take it away from you. Okay? So that's Joe Biden with a bit of garbled language outlining that the choice should exist, but that choice is ultimately dependent on your employer. The basic question, the ones preceding it as well, outline the position that, sure, your plan, Pete Buttigieg's plan, it allows for you to keep your employer plan if you wish, but what kind of choice is it if your employer cancels your plan? Then you don't really have a choice. It's either no healthcare, or it's the public option, or you're compelled to go on the public option. And so in essence, choice only exists for those who have the option to choose, aka they have the means for their own private insurance that they can buy as an individual, or that is provided through an employer, or they're forced to go on the public plan. That's the simple reality. So Joe Biden's choice isn't really a choice for millions of Americans. It's not a choice at all. And it outlines how so much of this rhetoric about choice is actually just about employers choosing. What Joe Biden and Pete Buttigieg are talking about, medicine choice, Medicare choice, choice of your own healthcare destiny, is actually just leaving it all to the employers. Because it's the employers who get to choose if you have a choice. If your employer cancels your plan, you lose your choice. Joe Biden says you get to keep your plan, but it's not really your choice. As he notes here, it's very clearly your employer's choice. So it's the boss that gets to choose, not the individual working and middle class American, but the capitalist class. They get to choose if you get to choose. And Joe Biden and others have made a lot of noise about how, this Medicare for all system is bad for some unions because they've negotiated good healthcare plans and Medicare for all will ruin it for them. And it's an attempt to sort of break Bernie Sanders' edge with unions. Bernie Sanders is a longtime labor champion, and there's maybe a thought that if you can make Medicare for all look like it's anti-union or at least somewhat antagonistic to unions, then you can sort of split the progressive base away from Bernie Sanders. But it has to be said that while a unionized work environment can't just unilaterally have benefits taken away because they are collectively bargained, they can be lost in collective bargaining. So what if your employer locks you out and forces you to either stay locked out forever and uses scabs and forces you to get rid of your health plan or lower the quality of your health plan, or say, you have health now, but you don't have dental and you don't have your medicine covered anymore because of the lockout? What do you do then? Do you have a choice? Not really. You don't really have a choice there either, and you're a unionized worker. What if you're a unionized worker who gets laid off? What if you're a unionized worker who gets read out of a contract due to being classified as a contractor? What if you're a unionized worker in a facility that gets shut down? You lose your health care, you lose your choice. So that's the fundamental rub here. Joe Biden, Pete Buttigieg, all the choicers, all of it is an illusion. You don't really have a choice when it comes to healthcare. All of it is largely dependent on people with much more social and political and economic power than you. If you're fortunate enough to have a workplace plan right now, in a sense, Joe Biden gives you a quote-unquote choice, because you can go with his public option or with the one that currently exists. But if you're laid off, or if you're poor, or if your job doesn't offer any form of insurance, or if the insurance at your job is insufficient, or for whatever other reason, there is no choice. And again, I have to underline this, the choice belongs to the employer and basically only the employer, especially in non-unionized environments, but even to some degree in unionized workplaces. They're the ones that get to choose if you get healthcare or not. And Medicare for all technically, in a sense, removes choice in that you have to be part of the system. But of course, you still have a wide variety of choice within single-payer systems. There are certain forms of insurance that can still be purchased. There are still going to be elements of healthcare that may not be covered, at least at first. You have the option to buy into those. Employers may still offer that. You still have the choice of seeing certain doctors. You still have the choice of picking particular people as family doctors. You still have the choice of getting certain forms of healthcare or not others. There is still a wide variety of choice within public healthcare options. The choice may not exist in terms of being part of the single-payer system, but at the end of the day, that's far better than the illusion of choice that exists for 99% of Americans who are one move away by their employer from having no choice at all. So this is just one line, but Joe Biden himself, the champion of choice, makes it crystal clear here. 100%. You have no choice. Your employer has the choice. Joe Biden doesn't want to change that. Joe Biden thinks that's ideal. Joe Biden says that's the obvious here. The obvious here is that your choice is really dependent on your employer. Bernie Sanders, what he wants is every single man, woman, and child to be on a single-payer plan, because that will guarantee, as a basic human dignity via citizenship, getting the healthcare you need when you need it. Whether you can pay for it or not, whether you're employed or not, whether you have a good job, quote unquote, or not. That's the only way forward. Choice be damned. When we're talking about fundamental human rights, the illusion of choice should not trump the need for equality.